If you have a Medicare Advantage plan and you think you are getting it for free, I need you to pay close attention to what I am about to explain, because there are some important things happening right now in March 2026 that could affect your coverage and your wallet. A lot of people look at their zero premium Medicare Advantage plan and think they are getting something for nothing. They see the gym membership, the grocery allowance, the over-the-counter benefits, and they think, why would I ever question this or ask for anything more? But here is what most people do not understand. You already paid for that plan. Before we get into everything you need to know, if you are not subscribed to this channel, hit that subscribe button right now and turn on notifications. We cover Social Security and Medicare news every week that directly impacts your benefits, and you do not want to miss critical updates like this one. Now let me explain exactly what is going on. When you worked all those years and paid into FICA taxes, you were paying for both Social Security and Medicare. All that money you contributed over the decades, that includes your Medicare benefits, and then every month you pay your Medicare Part B premium of $185 or more, depending on your income. Where do you think that money goes if you are enrolled in a zero premium Medicare Advantage plan? It goes directly to the insurance company. So these plans are not free. They are prepaid. You have already been paying for them your entire working life, and you continue to pay for them every month through your Part B premium. Here is what the numbers actually look like. For a relatively healthy person living in a less expensive part of the country, the Medicare Advantage insurance company receives approximately $500 to $700 per month from the government just to have you enrolled in their plan. For an average enrollee, they receive about $1,000 per month. And if you are sicker and have more health conditions, the insurance company can receive anywhere from $1,500 to over $2,000 per month. The sicker you are, the more they get paid. These are the estimated payments from Medicare to the insurance company of your choosing just to administer your Part A and Part B benefits. So when someone tells you their Medicare Advantage plan is free, that is simply not accurate. The government is paying the insurance company hundreds or thousands of dollars every month on your behalf. Now here is where the zero premium illusion really breaks down. Even though these plans have zero monthly premium, there are significant costs when you actually need health care. If you visit your primary care doctor, it might be $0 for that visit. But if you need to see a specialist, you are going to have a copay. And those specialists need to be in network, or you are going to pay even more, or you might not be able to see them at all. If you end up in the hospital, that is where the costs really start adding up. The in-network maximum out-of-pocket for some Medicare Advantage plans in 2026 is almost $10,000. So much for free health care. If you are healthy and you only need basic preventive care and visits to your primary care doctor, Medicare Advantage can work out well. But if you develop a chronic condition, if something happens to you, if you need hospitalization, if you need to see multiple specialists, you need to be looking at more than just the premium. You need to understand how much health care you might actually use over the course of the year. Right now, we are in the Medicare Advantage open enrollment period, and it ends on March 31st. This is important for anyone who is currently on a Medicare Advantage plan and is not happy with their coverage. If you selected a plan during the annual enrollment period back in October through December, you still have until March 31st to make a change. Maybe you picked a plan and then your situation changed. Maybe your health changed. Maybe you realized your doctors are not actually in network. Maybe you looked at the hospital costs and realized you could be on the hook for $400 a night when another plan charges $100 a night. Whatever the reason, you have until March 31st to switch to a different Medicare Advantage plan or to move back to original Medicare if that makes more sense for your situation. If you move to a different location, that creates a special enrollment period to adjust your coverage. This is important because Medicare Advantage plans vary county by county across the entire country. I have seen situations where someone living on one side of the street has certain plan options and someone living on the other side of the street in a different county has completely different options. If your address changed, even if you just moved across town, your current plan might not even be available anymore, or a better plan might now be available in your new area. One of the biggest problems people are running into right now is something called ghost networks. This is when an insurance company tells you that a doctor is in network, but when you actually try to make an appointment, the doctor does not accept the plan or is not taking attracting new patients. People are calling insurance companies every day asking for help finding a primary care doctor, and the insurance company sends them a list of doctors. But when they call those doctors, not one of them is actually in network or accepting patients. This is extremely frustrating, and it happens more often than it should. The good news is that for 2026, there is a special enrollment period that gets created when an insurance company tells you a doctor is in network, but they turn out not to be. If you were given misinformation about your doctor being in network when they actually are not, you should be able to adjust your coverage. Now, let me talk about prior authorizations and appeals, because this is where people really need to understand their rights. When you are on a Medicare Advantage plan, the insurance company has the ability to approve or deny certain health care services before you receive them. If you need an expensive procedure like a knee or hip replacement, that can be subject to prior authorization. If you need a brand name medication or a specialty medication, that is often subject to prior authorization or drug utilization management rules. The insurance company gets a veto on the care you receive, and sometimes they say no even when the care is medically necessary. Here's what I always tell people: appeal, appeal, appeal. It does not matter if we are talking about Social Security retirement, Social Security disability, SSI, Medicaid, Medicare, Medicare Advantage, or Part D prescription drug plans. These are large organizations. They are often understaffed. They make mistakes. If you think they made a mistake in your particular case and denied you for something you should have been approved for, you have the right to appeal. I see a lot of people who are hesitant to challenge these big corporations. They say, well, I am getting the plan for zero premium anyway, so I do not want to rock the boat. But you have rights. You paid for this coverage. If you are being denied something you are entitled to, fight for it. Let me explain the difference between Medicare Advantage and Medicare Supplement plans, because this is a decision that affects people for decades. Medicare Advantage, also called Part C or all-in-one plans, is managed care. You are in the world of network restrictions and prior authorizations. The insurance company takes on the responsibility of administering your Part A and Part B benefits, but they control which doctors you can see and what services get approved. Medicare supplement plans, also called Medigap plans, work completely differently. With Original Medicare plus a Medigap plan, you can go to any doctor or hospital nationwide that accepts Medicare. No network restrictions, no prior authorizations for most services. If Medicare covers it, your Medigap plan covers the remaining costs. Each Medigap plan letter type is standardized under federal law. A Plan G is Plan G regardless of which insurance company you buy it from. It offers the same hospital and medical benefits. The only differences between insurance companies are the price and the customer service. The most comprehensive plan available to people turning 65 after January 2020 is Plan G. Plan F was more comprehensive, but it is only available to people who were eligible for Medicare before that date. And here is an important point. If you are currently on a Plan F, the prices are going up considerably. The reason is that only Plan G is available to new enrollees, so the risk pool for Plan F is getting older and sicker every year. If you are paying more than $283 extra per year for Plan F compared to Plan G, you would save money by switching. Plan F and Plan G are identical, except Plan G does not cover the Part B annual deductible, which is only $283 for 2026. The prices for Medigap plans do go up every year. When the increase happens depends on your state, because the insurance company has to get approval from your state insurance commissioner. Some companies raise prices on your policy anniversary. Others raise prices on your birthday. If you are seeing large premium increases, you may be able to switch to a different insurance company offering the same plan letter type for less money. But there is a catch. If you are past your initial 6-month enrollment window when you first started Medicare, the insurance company can ask questions about your health history. If you have pre-existing conditions like diabetes or hypertension, you might not qualify. The only 4 states that have guaranteed issue rights regardless of health are New York, Connecticut, Massachusetts, and Maine. Now let me address something that affects higher income retirees. IRMA stands for Income-Related Monthly Adjustment Amount. This is basically a surcharge that raises your Medicare Part B and Part D premiums if your income is above certain thresholds. The standard Part B premium for 2026 is $185 per month, but high earners pay significantly more. Here's the key thing to understand. IRMA is based on your income from 2 years ago, not your current income. So for 2026, they are looking at your 2024 tax return. If you had a very good year in 2024, maybe you sold a house, maybe you had large capital gains, maybe you took a big withdrawal from your retirement accounts, you are going to see higher Medicare premiums now. If your circumstances have changed since then, you can appeal. There are 8 life-changing events that qualify you to request a new determination. The 2 most common are work stoppage and work reduction. If you retired or reduced your work hours, you can ask Social Security to look at your current income instead of your income from 2 years ago. The form is SSA 44 and you can find it online. Fax it back to Social Security and they will process it within 4 to 6 weeks. A married couple can potentially save over $12,000 on their Part B and Part D surcharges if they win their IRMA appeal. Unfortunately, there is no exception for the sale of a home. Congress never created that carve-out. So if your income was high 2 years ago because you sold your primary residence, you will likely have to pay the higher premiums for that year, even though it was a one-time event. For people who are dual eligible, meaning you have both Medicare and Medicaid, there are special Medicare Advantage plans designed specifically for you. These dual special needs plans coordinate benefits between both programs and often come with additional benefits. If you are turning 65 and currently on Medicaid, you should explore these options. You also qualify for Part D extra help, which significantly reduces your prescription drug costs. If you are living overseas or spending significant time abroad, Medicare generally does not work outside the United States. Original Medicare does not cover care in foreign countries except in very limited circumstances near the Canadian border. However, certain Medigap plan letter types, including Plan F, Plan G, and Plan N, come with a foreign travel emergency benefit. This covers 80% of emergency care for the first 60 days outside the U.S., up to $50,000 lifetime. Some Medicare Advantage plans also offer limited emergency coverage while abroad. If you travel frequently, this is something to consider when choosing your coverage. For anyone on Social Security disability who is under 65, your Medigap options may be limited or expensive depending on your state. But when you turn 65, you become a free agent again. You can sign up for any Medigap plan, and the insurance company cannot deny you or charge you more because of your health conditions. The bottom line is this: Medicare is complicated, but you have options and you have rights. Do not accept a denial without appealing. Do not assume your zero premium plan is actually free. Do not let ghost networks keep you from getting the care you need. And if you are unhappy with your current Medicare Advantage plan, you have until March 31st to make a change. If this information was helpful, make sure you subscribe to this channel for more Medicare and Social Security updates. Share this video with family and friends who are on Medicare because a lot of people do not understand their options or their rights. Thanks for watching, and I will see you in the next update.